and welcome to Health Center. I'm Lorraine Brooks, and I'll be your host for today's show. Here at Downstate Medical Center, we not only have University Hospital, which of course is where we treat sick people and help people to get better, but we're also what's called an academic medical center. An academic medical center, our academic medical center, encompasses many departments and many entities, one of which, of course, is University Hospital. But we also have a College of Medicine, we have a College of Nursing, and we also have what we call the College of Health-Related Professions. The College of Health-Related Professions has 6 programs, and we train students in physician's assistants, physical therapy, medical informatics, nurse midwifery, diagnostic medical imaging, and occupational therapy. My guest on today's show, in fact, is Dr. Joyce Sabari, who is Associate Professor and Chair of our Occupational Therapy program here at Downstate Medical Center. Welcome to the show, Dr. Sabari. Thank you for agreeing to come on the show today. I'm going to ask you a very basic question because I think that maybe a lot of people like myself don't understand what occupational therapy is about. So can you give us an idea of what occupational therapy is and what an occupational therapist does?
Sure. Occupational therapy is a health profession where we work with individuals who, because of a physical disability or a cognitive limitation, are unable to perform the occupations of their daily lives. Now, we don't use, in today's parlance, we don't use the word occupation the way it was used when the profession was first established in the early part of the 20th century. A quote that Thomas Jefferson is very famous for helps, I think, to illustrate what occupation means for our profession. He said that it is neither wealth nor splendor, but tranquility and occupation which give pleasure in one's life. And what he meant by occupation, which was common usage in the time, was the things that people do during their daily lives.
Is that not necessarily limited to what you do for a job, but other activities as well?
Right. Today we think of an occupation as only your job, but in addition to the things we do on our job, we do things that we do to take care of ourselves. We get dressed, we keep ourselves in fashion and dressed and bathed. We take care of children, young children. There's a whole array of occupations related to childcare. Traveling is an occupation. All the things that people do in one's daily life differ from one person to another, but can be impaired if a person has a chronic disability. So occupational therapists are experts in analyzing activity and in tailoring interventions to help people with specific diagnoses to get back into performing the things that they do in their daily life.
Now, you mentioned when you first began being physically impaired or cognitively impaired.
Right, let me give you an example of where occupational therapists would work, and now our graduates work in a variety of settings. Occupational therapists work in hospitals, on the rehabilitation unit of a hospital, with people who have had strokes or spinal cord injuries or serious levels of rheumatoid arthritis, for example. Occupational therapists also work in school systems and in home environments with very young children who have developmental disabilities that limit, to whatever extent, their motor development or their cognitive development, which is their capacity to learn and think. And the occupational therapist, regardless of the diagnosis of the patient, determines through testing, standardized testing, determines what specifically are either the motor impairments or the cognitive problem or a coping problem, as we also work with people with severe mental illness, what are the specific limiters to the individual being able to engage in the tasks of their daily life. And then we develop a program for the person, first to improve their skills to their highest level of potential, but also to begin to adapt their environment or the activities that they perform so that they can be independent, productive, and safe in performing activities in their daily lives.
So you deal with individuals through the whole life cycle?
Absolutely.
From childhood to
not
adulthood.
every occupational therapist would work with individuals through the life cycle and with individuals with different diagnoses. Most occupational therapists specialize in with a particular population and develop the body of knowledge that relates to that particular population. So an OT might be a pediatric specialist, might specialize even further in early intervention, which is babies from 0 to 3. An occupational therapist might specialize in people who have serious hand injuries and are recovering from complex hand surgery. An occupational therapist might specialize in psychiatric rehabilitation and work with people who have serious substance abuse recovery problems and are re-entering their community lifestyle after having been institutionalized, for an example. Or an occupational therapist may specialize in people who are recovering from stroke or traumatic brain injury. Those would be some examples of areas that occupational therapists become particularly specialized in or skilled in.
And the occupational therapy program here at Downstate trains students to do a variety of those kinds of things that you're describing.
Right.
Is that correct?
Right. Our students come to us with a bachelor's degree in any major, and they earn a master's degree. It's a 2.5-year master's degree, so it's a lengthy master's degree. And that degree prepares them to practice in any area of occupational therapy. Following the academic program, all of our students do a minimum of 6 months full-time field experience, so like an internship in other professions, and then they take a national certification exam.
So you're describing a 6-month internship, let's call it an internship. What kinds of things might an occupational therapist or an occupational therapy student do during that internship? You would assign them to a hospital, to a clinic, to a health center, or what kinds of things?
We assign students to 2 different sites, and we work with students to determine what their areas of interest are. And the sites can be an occupational therapy department in a hospital, in a rehabilitation facility, in a preschool, in a public school. Occupational therapists, along with speech therapists and physical therapists, provide services to children in public schools. It could be a geriatric facility, a skilled nursing facility for elderly people who are recovering from some long illness or a disability.
And our students work directly with the patients?
Oh, absolutely.
And they get hands-on experience?
Hands-on. By the time they're in the fieldwork too, they've already completed 2 years of professional education, which also consists of fieldwork experience throughout the 2-year curriculum. So they're ready. They're ready to go out there and provide treatment under the supervision of a licensed occupational therapist at the fieldwork site. So
part of what you do here then is to place our students in appropriate facilities so that they can gain that kind of experience.
Right. One of our fieldwork, one of our faculty members is the fieldwork coordinator, and that is her exclusive role. She meets with students to plan out where they're going to do their fieldwork experiences. She maintains communication and contact with a large array of fieldwork sites. We have over 300 fieldwork sites. And she places the students, and then she meets with the students while they're doing the field work. We have seminars. The students come back and discuss their experiences while they're on the field work experience.
That's wonderful. So a student, in order to qualify or in order to be accepted into the occupational therapy program, would need a bachelor's degree.
That's right.
Which is a 4-year undergraduate degree.
Right.
And you said that it could be in any discipline?
It can be in any major. However, there are a series of prerequisite courses that all of our applicants have to complete in order to be considered for the program. And
what are some of those courses?
The courses are biology, chemistry, several psychology courses, as psychology is a major foundation for occupational therapy. They have to take an undergraduate level anatomy and physiology course to prepare them for the human gross anatomy course that they take here. They have to take a statistics course, and they have to take either a sociology or an anthropology course to have some background in the social sciences.
If a person didn't necessarily have that coursework as an undergraduate, would they still be able to apply for the program? Would they be able to go back and perhaps make up that?
Right, that's an excellent question. Many of our students have graduated college a few years ago and have entered other professions, and they haven't taken these kinds of courses when they were in college, and they go back to school either while they're working, and that's very common for our applicant pool, that we have individuals who might have majored in art or in theater, in accounting, in computer science. We really attract a very diverse group of students. And they go back and they take these courses. And when they apply, they have to, by the time they enter the program, they must have completed all of the prerequisite courses.
Okay. I interviewed Dr. Morton Arias on a show not too long ago, who is the dean of the College of Health-Related Professions, as you know. And she told me that we have students enrolled in our programs who are former bakers and chefs and locksmiths, and you mentioned people who might be artists or people.
We attract a lot of artists
from all
and theater
kinds of
people.
backgrounds.
Yeah, the primary major for our students is the psychology major, and we do attract about half of our class are just graduating college when they come into our program, and they're submitting their applications during their senior year in college. But the other half have been involved with some other professional career. We have many teachers, people who've been involved in the arts, and really any other. Right now we have an engineer in our program. We've had people with computer backgrounds in our program. And most of them find out about occupational therapy through some personal experience. Either a family member has received occupational therapy services, or they meet someone who is an occupational therapist and they become intrigued with what occupational therapists do, and they pursue the career on their own.
So again, I just want to go back a little bit to what occupational therapists do.
Sure.
Say, for example, I have arthritis. How could I benefit from the services of an occupational therapist?
Not every individual with arthritis will require an occupational therapist. Generally, the rheumatologist who is treating, the physician who is treating the individual will make an assessment that this individual may require specialized orthotic device on the hand. That would,
what is an
orthotic device is usually plastic device that you wear, a person would wear on their hand. We make these with skill and art. Our students have a series of courses in constructing. They have one particular course in hand orthoses. And the therapist would make this device to be unobtrusive as possible, to prevent the progression of a deformity in the hand, or to prescribe specific ways of performing activities in order to prevent the progression of a deformity. Or if a person has had surgery for, they might have a prosthetic joint
say
to
for
replace.
example, a hip replacement or something like that.
Yes, or I was specifically thinking about hands, which are very seriously affected in rheumatoid arthritis. Then the person would go to an occupational therapist who may have further training and be a certified hand therapist to follow up with the rehabilitation after the surgery, based on the doctor's very specific prescription as to what's needed in terms of positioning the individual's joints and what exercises would be appropriate.
So there are subspecialties within the specialty of occupational therapy. There's a hand subspecialty, there's a mental health subspecialty, a pediatric subspecialty, a geriatric subspecialty.
Neuro rehab.
Neurology, neuro meaning neurology.
Because people with neurological impairments like stroke or brain injury or multiple sclerosis or Parkinson's disease have many physical or motor or perceptual deficits that could interfere with daily activity performance, and these people can benefit from occupational therapy intervention.
Describe a perceptual deficit.
Perception is how we interpret sensory information. So
sensory information meaning
sensory information, we all are experiencing the world through our senses, our tactile sense, vision, hearing, taste, but also proprioception is interpretations of where our joints and our muscles are and where we are moving and how we are moving. And vestibular sensation is information about where our body is in space.
And if that's impaired?
If that's impaired, we call that a sensory processing disorder. That can be impaired with a person with a neurological diagnosis. It could be impaired in children who are diagnosed with learning disabilities or autism. And occupational therapists have specialized interventions to help people improve their sensory perception. Or in the case where the individual needs to compensate, we develop strategies with the individual, and if there are caregivers, to structure activities in a slightly different way. I'll give you an example of that. A fairly common perceptual disorder after a stroke, particularly a stroke on the right side of the brain, is what we call left unilateral neglect, where the person may have intact vision. They may not need glasses, or whatever glasses they have are sufficient for them to see correctly. But because of the brain injury, the individual doesn't pay attention or notice the left side of visual space. And
that's
this is very debilitating.
Related to the neurological damage caused by the stroke.
Right. And this can be very debilitating. Imagine you're reading a newspaper and you don't see the left side. Imagine you're sitting down to eat dinner and you don't see where your fork and napkin are in the left side of your visual space. And occupational therapists have interventions, number one, to improve a person's attention to the neglected side, but also to compensate. So a simple example of a compensation is teaching people to use a red ribbon, or not red ribbon, yes, a red ribbon, and placing it on the left side of the page of a book while you're reading, and remembering to themselves, look for the red ribbon. And whenever they go back to the next line of text in the reading, the presence of that red ribbon helps to orient them to the ultimate left side of space.
So there are skills that you can teach, or skills that people can learn that will help them to, as you say, compensate for whatever deficits they may suffer as a result of their condition.
Right. Or to improve their function. Many people can move past that red ribbon through many different kinds of experiential practice opportunities, and they can learn their own strategies for coaching themselves to overcome this, this deficit, and they may not need the red ribbon after a period of time.
Activities of daily living, you used that phrase.
Right, right.
Can you talk a little bit about what activities of daily
Sure.
living are?
Sure.
What are some of the things that might be impaired?
Absolutely.
Among people who have problems?
Activities of daily living are all the things that we do every single day that we don't even give any thought to. You wake up in the morning, you turn over, you turn off the alarm clock, you get up, you go to the bathroom, you use the toilet, you get into the shower, you wash your hair, you open up containers for toothpaste, for shampoo, you wash your face, you pick your clothes, you get your clothes from the closet, you put your clothes on. Those are all activities of daily living.
And those are things we don't usually pay attention to until we can't do them any longer.
That's right.
Right? Until we have a problem reaching in the closet for something, or not being able to get a top off of a jar.
Exactly.
I noticed that for myself, I'm getting less and less able to get the tops off of jars. I have arthritis in my hands.
Right.
And you don't notice those things until they become an issue.
Until they become an issue. Absolutely. And
so the things that we do every morning that may take 15 minutes, I mean, you described a scenario of getting up, turning off the alarm clock, taking a shower, may not take more than 10 or 15 or 20 minutes for most of us.
Right.
But if you have some kind of impairment, I would imagine that those things would probably
insurmountable.
Take significantly longer.
But with training and also improving your function to their maximum potential, people learn to perform these tasks on their own. And that brings tremendous sense of satisfaction when you've had to depend on somebody else to do these basic tasks for you. That achievement of being able to do this for yourself. This is not a glamorous story, but OT is not a glamorous profession. It's a nuts and bolts profession. But I recently ran into on the street a patient that I had treated when I was a home care therapist, and of course, we exchanged hugs and warm greetings, and we talked a little bit, and then at the end of the conversation, he said to me, "You know, Joyce, I hope this sounds okay, but every time I go to the bathroom, I think of you, that before I met you, I couldn't do that basic thing for myself, and now I can. Now I don't need somebody else standing over me in this most private and basic of human activities. I can do this myself." And people feel more human when they're able to be independent in the tasks of their daily lives.
Well, you say that it's not a glamorous profession and it's a nuts and bolts kind of profession, but the story that you just shared to me is about human dignity even. You know, the fact that you can help someone to be not just independent, but to maintain their sense of dignity. And as you know, some things about life are very private. For example, using the bathroom or taking a shower or those kinds of things. And I think when we lose the ability to do those things, even temporarily, after surgery or whatever, or because we're sick, temporarily, it does have the sense of diminishing your sense of independence and dignity. I think that's a very important function. Even though you don't describe it as a glamorous profession, what could be more rewarding than having an experience like that?
Most of our students, I keep in contact with our graduates, and most of them tell me that this was the greatest decision of their life. They feel happy with what they're doing. They feel that on a one-to-one level, they make a difference in the lives of the people that they're working with. And at the end of the day, they feel good that they've done positive things, in very concrete positive things to help the people that they've worked with.
Well, can you quickly describe some of the activities that some of our faculty is involved with? I know we have a lot of interesting faculty here.
Yes, we do. We have I'm very fortunate. We have an amazing faculty in our occupational therapy program. Each one of us is a specialist in a different area of practice. So Suzanne White is our mental health expert, and her major project right now is she's developed an intervention program for people with severe and persistent mental illness to help them develop time management skills. And this is a group protocol that she has run herself and is now training therapists in other facilities. And we've done one research study so far, which has yielded beautiful results in improving these people's ability to organize their time during the day, because that's also an activity of daily living, to plan where you're going to be, to get there on time. And she's had a few publications, very nice publications, interdisciplinary and within the occupational therapy program. So that's one example of a faculty project.
Dr. Sabari, I'm sorry, I'm going to have to stop you.
Okay.
We're running out of time. But perhaps you'd like to come on the show again and talk a little bit more about what you and the other faculty members are doing. Quickly, if you could give people a way of getting in touch with you if they're interested in the program.
Sure. First of all, I encourage people to go to our website, which the Downstate website is www.downstate.edu. And to get to occupational therapy, continue that with /CHRP/OT. That
Great.
stands for College of Health Related Professions and Occupational Therapy.
Thank you so much, Dr. Sabari.